I'm Sue Vincent. I was part of a clinical trial started back in July of 2010. It was study 41 and it was a PARP inhibitor called olaparib. Okay, so I was diagnosed with ovarian cancer in September 2007. I had radical surgery followed by chemotherapy of carboplatin and Taxol. And for anyone that's gone through chemo will know that it's far from being a pleasant experience. Early in 2008, I realised that tests were done and I was BRCA2, as well as my mum being BRCA2 as well. Mum had breast cancer when I was still at school, and nobody had ever made that connection in those early days between breast cancer and ovarian cancer. So this became a complete shock because I'd had regular mammograms but no tests for ovarian cancer. I relapsed in 2010, had a recurrence, and at first, because I'd had a double risk reducing mastectomy, we thought that maybe my CA125 had risen because of the operation, but unfortunately it wasn't. I had got a recurrence. When I had the second recurrence in 2010, the prognosis wasn't good. We were looking at perhaps 12 to 18 months life expectancy, because obviously every time your ovarian cancer reappears, the time is shorter. I have the most amazing consultants who told me about this clinical trial. And I have to say, when she first showed me the paperwork, I was not impressed. I thought, no, I don't think this is really for me. My prognosis on a second recurrence wasn't good, and my consultant was so supportive in terms of this clinical research and felt that it was really something that I could benefit from. She worked with me, she supported me, and in July 2010 I started taking olaparib, 16 capsules a day, 8 in the morning and 8 in the evening, whilst having obviously 6 rounds of chemo again. Was I scared when I started the clinical trial? I was apprehensive. I didn't know what the future held. The prognosis wasn't good. So my feeling personally was I hadn't got really anything to lose. But the care, attention, the support that I got was just absolutely amazing. All my questions were answered straight away. I was never left wondering what if, what's happening. Communication from start to finish was amazing. I am extremely lucky. My medical team are wonderful, and without their support, I'm not sure I would have found the clinical trial as easy, because they made it so simple for me. They reassured me, they supported me all throughout. So, looking at the clinical trial, and the opportunity that was given to me, it was a little bit of a no-brainer, because what had I got to lose? But also, what really helped me make the decision was the determination and the support from my consultant, who was well informed, kept me well informed, and I had utter faith in her. I knew that she was going to do everything she possibly could to extend my life, and therefore it was up to me to help her, not work against her. So I had complete faith in Dr. Williams when she said she really wanted to put me forward for this clinical trial, that she was doing the best by me. And here I am, 13 years later, and she certainly has done the best by me. But I think back, if I'd have said no to that clinical trial in 2010, if I'd let any fears and concerns that I'd had, take over, I'd not listened to the medical team and had such great support in them, then I wouldn't have had the last 13 years. I wouldn't have seen my beautiful 5 grandchildren born. I wouldn't have been such a major part of their lives. I'd have missed all of that. So for me, clinical trials are a sensible way forward. If you get offered a clinical trial, go for it. What have you got to lose? But think of all the things you've got to gain. You've got quality of life and extension of life.